Hi, I'm Julia Reifman. I'm an assistant professor at the Boston University School of Public Health, and I run the COVID-19 US State Policy Database. We designed this database to inform rapid response research on COVID-19 prevention policies and policies to address economic precarity during the COVID-19 pandemic. We know that there's an urgent need to inform policies in a rapidly changing policy context, and we hope that sharing our website and how you can download our policy data will help you contribute to this research. This is the statepolicies.com website. And I think for researchers, you'll want to go straight to the data. But if you want to, you can read about COVID prevention policies, policies to address economic precarity, and policies to shape a healthier and more equitable future based on the research that's been done so far. These also have great examples of how other researchers have used the data. If you go to our data library, you can find a free download of the whole CUSP dataset, which has more than 200 variables. You can also view the code book and how we've defined each of those variables. And we also provide the raw data if you would like to define your own variables. But 200 variables is a lot to work with. So we've also provided data sets with smaller amounts of policy data on specific topics. So here we have the COVID prevention policies, such as vaccine priorities, face mask mandates, physical distancing policies, and policies pertaining to people who are incarcerated. I really want to highlight our data on economic precarity because these have taken on such great importance, and especially for people who are living in low-income households where the bulk of unemployment was concentrated. In this context, unemployment insurance has been really important, as have policies to prevent food and housing insecurity. And then we have policies related to health and equity that are important for shaping population health in all times and especially now. And that includes workplace protections for COVID prevention and state minimum wage policies. Now, just to give you a peek at what some of the data look like and what you'll find, we can look at something like the vaccine distribution timeline. And we'll always provide data on the state name as well as the state abbreviation and FIPS codes when you download the CSV, so that it's really easy for you to link these data with other data sets. Here you can see that there's a lot of variation in when states made essential workers like teachers and grocery workers eligible for vaccines, ranging from January to April. And so you can take advantage of that variation to evaluate how those different priorities shape population health and health equity. Similarly, you can look at something like housing policies, which we've provided in partnership with the Eviction Lab and Emily Benfer's team. And you can see that states really varied in whether they had an eviction moratorium, when it started, when it ended, and whether they froze initiations of evictions or enforcement. And to give you a sense of the data sets with which you may pair the CUSP data, we often recommend the household pulse survey data because these are state representative data on COVID, as well as things like food and housing insecurity and employment. The New York Times has data on COVID-19 cases and deaths overall, and in some special populations like people who are incarcerated. And there are physical distancing data that people have paired with our data on physical distancing policies. We hope this brief overview has been helpful, and we also encourage you to reach out. We really hope that this database will facilitate widespread research on policies that we think are really important and that are much bigger than any one research team can do. So if we can help you get started on research, if we can help you merge your data set, if we can help you provide linked data on your website, combining your data and our data, if we can do anything to improve the usability of the data, we are happy to be in touch. And most of all, we just can't wait to read your research and help it inform policy. So thank you, and we look forward to being in touch.